We've come a long way since Louis Pasteur and the chicken cholera, and yet some things haven't changed. Pasteur wouldn't be surprised by vaccine skepticism, toxic political dynamics, or the need for persistence. 1 year on from the European Union's vaccination day, the Active Citizenship Network is calling for an evaluation of the lessons learned as we continue to advance with COVID vaccinations in Europe. They're advocating for routine vaccinations across the whole of the Union, not just a one-off phase to mitigate COVID, but a long-term commitment on prevention with deep and wide participation by civil society, those closest to the citizen, trusted by citizens, and best able to boost vaccine coverage. The European Commission is actively working to tackle the issue of low vaccination coverage in Europe with policy initiatives to support member states across the Union. To achieve this, strong engagement by all stakeholders is needed to tackle low vaccination coverage and vaccine equity. The Commission's objective is to strengthen cooperation and coordination across the EU, creating added value and bringing industry and other stakeholders together to enhance vaccine policy, aligning vaccination schedules, tackling vaccine hesitancy, streamlining research and the vaccine supply chain, but also to ensure the most vulnerable are reached quickly. The Active Citizenship Network, an EU branch of the Italian NGO Cittadina Iniziativa, believes there is now a unique opportunity to strengthen cooperation among stakeholders at the EU level, including health authorities, the vaccine industry, research and innovation, healthcare sector, and others. The challenge is to increase investments principally because life course immunization should now become a priority in healthcare budgets across the EU, starting with the next generation EU and the national recovery plans. Currently, all 27 member states are moving at different speeds and in different directions on vaccine policies. Now is the time to change that and to ensure that all European citizens benefit equally. What's your assessment of the vaccination campaign in your country?
We have reached quite a high vaccine coverage. I say quite high because it's not totally equal on the French territory, for example. There are some areas where the vaccine coverage is less high.
We need to ask ourselves how to better integrate civil society in the vaccination-related initiatives in order to make sure that the hard work and progress reach a more general audience.
At a European level, how has the vaccine campaign performed?
Gradually, over the past year, most of Europe's gradually caught up and indeed in some cases surpassed the United Kingdom. So it's a bit of a slower start, but has kept going strongly throughout the year.
Vaccinations across all ages should become a priority in healthcare budgets, starting with the Next Generation EU and the national recovery plans. But now, more than other periods, it's time to work to build a proper life course immunization culture and an increased civic health literacy and multi-stakeholder collaboration.
And on a global level, what does the vaccination campaign look like?
Well, the big factor at a global level, Brian, is I think cost and access and availability. There's been a huge debate, and rightly so globally, about two facets of this. One is the wealthy developed West developing the vaccines and keeping them for themselves. But in a sense, a more scientific argument that you'll never stop the pandemic or wipe it out if you just vaccinate your own country. If you don't vaccinate people in poor parts of Africa and Asia and South America, you're deluding yourself that you will somehow keep the virus in those countries.
We are failing to vaccinate all the countries at the same level. I'm very happy to see that in Europe or in North America, the vaccine coverage is high, but if we do not vaccinate everyone in the world, all the world is still in danger.
What should be done to support routine vaccinations, and have lessons really been learned in the last year about the vaccination process?
There are 5 key actions that can be undertaken to support routine immunization. The first one is to prioritize routine immunization as an essential service across the life course. The second is to improve access to routine immunization through expanded delivery services. Third one is to ensure financing of vaccination programs. Fourth is to strengthen immunization data system. And the last one is to continue building trust and confidence in vaccination.
A lot of research has shown that when the right choice is made, the easy choice, people go for it. They want to be vaccinated. They want the children to be vaccinated.
We wish to continue to mobilize health professionals, expanding vaccine delivery channels, working closely with civil society groups, utilizing the increased public interest for vaccines to act in general on communication and on the relationship with health professionals as trusted sources of information.
Without Pasteur's vision and tenacity, skeptics may well have won the day. As we move forward together, we must still look to the past. The European Union was formed in response to the destruction of war. Today, the battlefront for Europe is the pandemic. Fortunately, science does not retreat, nor should our trust in science. More than ever, healthcare is bound with a sense of personal responsibility, and this is emerging as the unifying narrative for our democracy. We're all in this together.